really want your input to develop new ideas, to get ideas for projects, to get ideas about what the myeloma community should be thinking about and action items for the myeloma community.
We are, let's say, more than 100 experts in the field, so that's really important to have this time for discussions.
What is the best frontline therapy? What is the role of maintenance? What about second primary cancers, SPMs, new drugs? How will we be using them moving forward? And what about smoldering myeloma?
This is a unique opportunity to have an exchange of ideas and to some extent, probably even more important, to create consensus and create a guideline of treatment that can be delivered on a in broader areas.
This year is even more attractive because it has been a scheduled short time for presentations and plenty of time for discussion. And this really has been a tremendous opportunity just to know how the other people think, how the other people create new ideas, generate new ideas, and what is going to be the next step in myeloma.
And every physician in the community will make sure that they start the patient on treatment before they send them.
No, it's a preclinical. It has a preclinical meaning. In the clinic.
Yes, it has not translated yet into a cure or prolonged survival, but I think it's the first steps toward that.
This has been another major discussion this morning, and it's very important to change the treatment paradigm, to try to treat as early as possible, to increase the proportion of a cured patient, but also to increase the outcome of the general population.
Michel Attal will lead this one, and then we lead this one. So
it's actually going to be less than that because many of them are not going to have appropriate donors, and many of them are going to be too old.
So that gives the opportunity to analyze, comparing with other patients.
we do have new options such as pomalidomide, carfilzomib, HDAC inhibitor, monoclonal antibodies, and we need new classes of drugs, and we are discussing about these new agents.
Is what is important, to generate new ideas to improve the diagnostic test, the treatment, the monitoring of the treatment for the myeloma patients. This is the reason for this meeting, the myeloma patient.
The past couple of days, I've had the privilege of spending time with the leading myeloma experts in the world and listening in on the discussions and debates that we're taking on regarding many issues in terms of clinical practice, in terms of new therapies, how these therapies are being used, et cetera, et cetera. So what I really enjoyed is being able to be part of that and to understand the critical issues that our leading myeloma experts are facing in their clinical decision making.